It is with regret that I have to vote no on this measure. I was listening to Senator Recto, and all the more I'm convinced that a no vote has basis. Mr. President, it has been 7 weeks after this chamber approved on second reading the Bayanihan 2. Extremely disturbing news of alleged massive corruption 7 weeks after in PhilHealth hit the country's news headlines. In the days to come, I understand hearings will be conducted to look into these serious allegations of misuse of COVID-related funding right in the middle of the pandemic. Today, nearly 2 months after the government imposed a May 30 deadline to achieve 30,000 tests daily, we have failed to meet that target with over 10,000 backlog cases as of today. Today, nearly 5 months after March 15, the lockdown, and after experiencing the longest community quarantine all over the world, the total number of COVID cases continues to rise, with 82,040 cases and 1,657 new confirmed cases and deaths now nearing 2,000 as of July 27, 2020. In contrast, Thailand to date has 3,292 cases. Malaysia has 8,897 cases, and Vietnam has 420 cases. The difference in the numbers is glaring and disappointing. Clearly, compared to all other countries in the region, save for Indonesia, whose population is nearly 3 times larger than ours, we have failed to stop the spread of the disease and have been unable to meet our own imposed targets and deadlines for mass testing, contact tracing, and isolation. The Senate last April correctly called on the resignation of Secretary Duque for his failure in leadership. Sadly, his incompetence, and worse, his being linked to corruption, has been condoned and has been left unpunished. I'm afraid, Mr. President, that unless Secretary Duque is fired or is forced to step down as chairperson of the IATF, the country will only see more incompetence and more corruption issues hounding the government's efforts in addressing the pandemic. It must be underscored, Mr. President, that a review of the provisions of Bayanihan 2 that we just approved on third reading will show that of the first 26 interventions listed by the law in Section 3 as necessary to effectively combat the pandemic, 13, or half, of these needed interventions are placed on the shoulders of the DOH. I'm afraid that under the mediocre leadership displayed consistently since the pandemic hit us, none of these 13 interventions will be met or achieved, and billions of funds will be spent yet again without our achieving the results necessary to manage the spread of the disease effectively. Without an effective management of the spread of the disease, Mr. President, we will be unable to reopen the economy. And in failing to reopen the economy due to the failure of the DOH to bring COVID to manageable levels, then our economic recovery will be elusive, and widespread hunger and joblessness will persist. In addition to the poor performance, Mr. President, I believe the amount of 160 billion is inadequate to address the economic losses we are now facing. To be fair, the Senate, through Senator Vergara, proposed a much higher amount in the original committee report, but this was not what the Executive Department had in mind. Originally, the Senate committee report recommended the amount of 236 billion. It is also my belief, and I know this is shared by several other colleagues, that to be able to face what is arguably the most serious health and economic crisis since World War II, it will require more than just 160 billion worth of government funds. And as Senator Recto puts it, 13 days of salary.